if I could speak to that a little bit. A lot of times we think that if we jail drug offenders and jail people that have mental issues, that we're keeping the society safe. No, we're not. You're putting a Band-Aid on a sucking chest wound. It doesn't work. It doesn't work. Now, people are going to bash me for this. I don't know if anybody knows anything about the drug rehab that they do in Rhode Island. Has anybody heard of that? They've got a company there that can all be run through health insurance. So now we can do it through health insurance and Medicaid and Medicare. And we can take care of these people that have drug problems. They've got a 68% success rate with this, whereas right now we've got less than an 8% success rate with jail and release. 8%. And that 8% only accounts for the people that tried it once, got caught, we're never going to do it again anyway. There's your 8%. But people that have a tendency to abuse drugs have a chemical imbalance in their brain. They also have a habitual nature to them. I can understand habitual natures. Anybody seen this in my back pocket? I've been chewing it for longer than most of you have been alive. I do it as a public service so nobody gets hurt. Okay? It's my excuse. But people with habitual natures do certain things. Now they found in Rhode Island that if they can get these people that go into prison or into jail they have these drug problems, what they do is they test them on 3 different drugs. They test them on Suboxone, they test them on methadone, and then they test them on the third one is, can't think of the third one right now. But they find the one that works, that levels out their brain chemistry. Now what they do is they have a coach, just like AA. They have to have somebody that they talk to. And if you don't think I'm not going to be putting a lot of pressure on the churches, think again. As sheriff, I am going to absolutely welcome the churches into helping with this. It needs to be done. It needs to be done. But what we're going to do is we're going to get coaches for these people. And then what they have to do is when we find that one drug that worked for them, that levels things out, they have to go to a dispensary every day at a certain time and take that one pill under supervision. 7 days a week, 24 hours a day, 365.25 days a year. That's what gives you your leap year. Okay? So, they've had 68% success rate with that. Why are we afraid to do it? Why shouldn't we do that? Because this is a medical issue. It's also a spiritual issue. Let's not forget, John Adams said our Constitution is only good for a moral and religious people. It's wholly inadequate for the government of any other. And if you have to agree with me, we've lost a lot of morality and we've lost a lot of religion in this country. And this is where we're at. This is why I'm going to put a lot of pressure on the churches to be involved in help with the Sheriff's Department. It's an absolute necessity if we're going to heal our society, if we're going to heal our community. It needs to happen. Now, Rhode Island's doing this program, and there's no reason why we can't do this program in Hillsdale. And I'll spearhead that, and I'll get that done. So once we take care of some of these people that are homeless because they have a drug addiction problem, I listened to a gentleman, he'd been drug addicted for 25 years. He'd lost all contact with his family and everything. Since he started this program for 16 years, he's maintained a job, he now has his own home, and he now has his family back. And he has a normal life that he never thought he would ever have, because they dealt with it as the medical issue that it was. And we can do this with our Medicare, Medicaid, and health insurance. We can do this.